Okay, we're recording another video. This time it's about Gestalt therapy. And with me is Sanja. Thank you for joining me. Sanja is a colleague from a different therapeutic approach. Sanja, maybe you could say something about yourself.
Hi, Mina. Thank you for asking me to do this dialogue with you. I'm a psychologist. I'm in my final year of my master studies in psychology. I'm also in my fourth year of training in relational TA. So I'm a psychotherapist in training under supervision. And I work as a volunteer in two non-governmental organizations. That's short about me.
Thank you. And just if somebody doesn't know, TA stands for transactional analysis, and relational transactional analysis is, well, one day we'll talk about that, how it's different from the classical transactional analysis. And in our dialogues, we have about 20 different therapies. We don't have relational TA there, but maybe you and I can construct a dialogue for that. We have something called transference-based psychoanalysis, which is like relational psychoanalysis. So we'll maybe we can do that in the future. But today we're talking about Gestalt. Now, my training is in integrative therapy, and we do lean heavily on Gestalt and combine it with body therapy and but also TA, some elements of transactional analysis, such as script and script decisions and things like that. So, but today we'll look at Gestalt in, I guess, the most classical sense, how it would work with this client. Do you remember what is the presenting problem of the client?
Yes, he has some issues with telling his boss that he wants time out from work.
That's right. So he needs, or she, in this case, probably he, time off. And Gestalt therapist, I'm going to read from our Google Doc and we're going to take turns reading. So a Gestalt therapist would approach this client's fear of asking for something from authority figures by exploring the present moment experience, heightening awareness and focusing on the client's internal process. Here's how they might work with this issue. So the first segment here, exploring the here and now. Would you read what that means?
Okay. A Gestalt therapist would encourage the client to stay in the present moment rather than talking abstractly about authority figures. They might ask questions like, what are you feeling in your body right now as you talk about authority figures? This helps the client become aware of their physical sensations and emotions as they face the fear.
So the here and now and within the body. Awareness of avoidance patterns is next. The therapist might explore how the client avoids asking for things from authority. In this case, asking for time off from authority figures. This could involve identifying patterns like minimizing their needs, like maybe I don't really need time off, feeling anxious or freezing in such situations. By becoming more aware of these avoidance mechanisms, the client can begin to recognize and work through their usual responses. So it's not even necessarily about learning how to do things differently, but just becoming aware what happens when you try to do what you try to do. What happens in your body, what happens in your thought process, and what feelings you have. Next one is
experimenting with new behavior. In Gestalt therapy, the therapist might invite the client to experiment with new behaviors in a safe space. For example, they could role play a scenario where the client practices asking for something from an authority figure. The therapist could take on the role of the authority figure, allowing the client to experience their fear in the moment and explore different outcomes.
So experimenting in this relationship. Working with polarities is the next one. Now, I do know that Gestalt therapists love to notice polarities and talk about polarities. My personal therapist is Gestalt. I work with a couples therapist who's a Gestalt therapist. And it's true, we are always in these polarities. We talked about that when we discussed IFS, like one part wants this, the other parts want that. But they really do, I think, like to notice polarities. Gestalt therapy explores internal conflicts, and they call them polarities. The therapist might explore the part of the client that wants to ask for something, or versus the part that feels afraid. So just like parts in IFS. But I must say, Gestalt precedes IFS. So we can only say that IFS takes this from Gestalt, not vice versa. Where am I? Um, this can help the client integrate conflicting feelings and move towards a more unified sense of self.
Okay. So, body awareness and grounding. Somatic awareness is crucial in Gestalt therapy. The therapist might focus on the physical sensations that arise when the client thinks about asking for something from authority figures. Helping the client become grounded in their body can reduce the intensity of fear and increase their capacity to stay present in difficult situations.
So staying grounded in their body, like this body work is inherent in Gestalt therapy. Nowadays we have like body therapy, but really, I would say in Gestalt you have it all. It's all holistic anyway. Um, Mindfulness, awareness, body work, it's all there. Um, which
I
is
like
why
that
it's,
about Gestalt.
yeah,
Sounds great.
I've, yeah. And then I would say that cognitive behavioral therapists add bits from here, like body work, awareness, mindfulness, and that I guess that's the third wave of CBT or cognitive. Anyways, feel free to correct me, people, if you're watching this and you know more about it. I also wanted to say, Sanja, you and me say it differently, Gestalt and Gestalt. And I think there's no right way. I've seen people say both. I've heard people say both. What do you say, Gestalt or Gestalt?
Yeah.
Gestalt. So
Yes.
people in
Sounds
the
like
comments.
more Serbian.
No, I've seen some British people say Gestalt. So oh, we can explore that. Maybe there is the right way, but I'm not sure which one it
I
is.
suppose that Gestalt is like more similar to the German
It sounds
pronunciation.
German, but
Yes.
I could be wrong. Number 6 is me. Exploring the relationship with authority figures. The therapist would explore the client's personal history with authority figures such as parents, teachers, bosses, to understand how these past experiences do shape their current fear. So, although we said it deals with the here and now, that doesn't mean Gestalt is not interested in what happened in the past. This can bring insight into the emotional baggage that comes up in these interactions and provide space to renegotiate their feelings around authority. That sounds like redecision therapy or something like that, making a script
Yes. Yes.
decision.
Yes. And like the people who made the redecision theory actually relied on Gestalt, and it's like a
Mm,
mix of TA and Gestalt.
that's right. I think you can trace any modern therapy back to Gestalt and psychoanalysis. But anyway,
Yes.
you're reading number 7.
Okay.
You're gonna like number 7.
Focusing on the therapist-client relationship. Since the therapeutic relationship is central to Gestalt therapy, the therapist might inquire if the client feels any fear or hesitation in asking for something from the therapist. Exploring the dynamic in the session allows the client to experiment with new ways of relating in a safe environment. Yes, that's really similar to what the point is in relational TA, like really checking with the client what's going on between us right now, and checking for your feelings and transference and content transference.
That's
That's
right.
the main thing in relational TA.
That's right. And I guess I would add they may not ask you directly, "Oh, okay, so how does it feel?" I mean, they may ask, but the client might say, I know I might say, like, no, everything's fine. I wouldn't necessarily admit or even be aware of how I really feel in that relationship. But over time, Gestalt therapists will always bear in mind that whatever is happening between me and the client could have something to do with how they are elsewhere or what happened to them in the past. Now let's go to the role play so we don't make the video too long, although I could talk to you about this for a long time. So you want to be the client or therapist?
Okay, I can be the client.
All right, I'll be a Gestalt therapist. And it starts with the therapist saying, what's happening for you right now as you think about asking your boss for time off?
I feel nervous, like my throat is tight, I'm shaking a bit.
Let's stay with that. Can you bring more awareness to the shaking? What's it like to allow that movement in your body right now?
It feels strange, but the shaking makes me realize just how tense I am.
Let's go deeper into that tension. Can you exaggerate the shaking? Let it be bigger, as if your body's amplifying this reaction.
It feels intense when I do that. I'm almost vibrating, like I'm holding so much inside.
What does the shaking want to express? Let's give it a voice. If it could speak, what would it say?
I think it would say, I'm scared, I don't want to get in trouble.
Let's stay with that. Can you imagine that fear speaking directly to your boss? What do you want to say to him in this moment?
I don't want to disappoint you. I'm trying my best, but I need a break.
As you express that, how does your body feel now? What's happening inside as you speak those words?
My chest is tight, but there's a sense of relief too, like I'm finally admitting something.
That's really important. Your body has been holding on to this fear, and by expressing it, you're starting to release some of the tension. Let's go back to the tightness in your chest. What's that like for you now? And they probably would invite you to touch your chest and notice.
It's heavy like a weight, but I'm also a bit lighter after I spoke up.
Let's explore that weight. Can you give it a shape or color? Does anything come to mind when you focus on that heaviness?
It feels like a big rock, gray rock. It's been there for a while, weighing me down.
Can you interact with this rock in any way? Maybe you want to carry it, push it away, or speak to it. What feels right for you?
I just want to put it down. It's too heavy to keep holding.
Let's visualize that. Imagine yourself setting this rock down. How does your body respond as you let it go?
I feel lighter. My chest doesn't feel as tight now.
That's beautiful. You're allowing yourself to release something that's been a burden. We'll continue to explore what this weight represents and how you can continue to express these feelings instead of holding them inside.
It feels good to finally let it out. I didn't realize how much it was affecting me.
These sensations in your body are communicating with you, and by tuning into them, you're uncovering deeper emotions and beliefs. We'll keep working with this energy to understand more of what's happening beneath the surface. That's the end of the dialogue. Um, I guess it's like an idealized version where
Yes.
they give the psychoeducation and everything happens
And it looks
smoothly.
like they've been working for a while because it's like a perfect session where the client is there collaborating with the therapist and
Mhm.
really feeling and doesn't oppose or just goes along with it.
Yeah, I guess all of these ChatGPT dialogues are written as if it's somewhere deep into the relationship to give us an illustration of what true Gestalt work can be like. Now, Gestalt therapists, please comment if you think this is preposterous. It's totally off. I think it's not far, not too much off base from my experience with Gestalt therapists. And
I
now,
just noticed, sorry for
yeah,
interrupting, the therapist is asking like two or maybe two, sometimes three questions, and it can be a bit confusing for the client. Maybe that's a little off.
yeah,
I'm a seasoned therapist.
yes,
Like,
exactly. As I was reading it, I feel a bit. weird asking yet another one and another one.
Yes, yes,
I
yes.
almost didn't want to read them all. That's a good point. I think it makes sense to, or
But
rather that it doesn't make sense.
but I liked the way the therapist was bringing client back to the sensations in the body, really trying to help the client to connect with the sensations in the body. I like that about Gestalt.
Yes, it's always about zooming in and paying even more attention to the unpleasant feeling than learning how to just regulate and not feel. Okay, we're already over the 15-minute limit, so I'll just quickly read the summary. And it says Gestalt therapist working with a client who is afraid to ask their boss for time off would focus on bringing the client's present moment experience into awareness, so their feelings, thoughts, and body. They would encourage the client to explore emotions, thoughts, bodily sensations that arise in relation to this fear. The therapist might guide the client to become aware of any unfinished business from the past. This is a key word in Gestalt therapy, unfinished business. And that's basically the Gestalt, I believe, means a completion. And the idea is to actually finish the unfinished business.
Or like the synonym might be unintegrated experiences.
Yes, yes. So like for example unresolved feelings towards authority figures and how these affect their current situation by using techniques such as role play, empty chair dialogue. We didn't have this here, but sometimes they would
Yes.
maybe take that gray rock and put it on the empty chair and talk with it. um, so role play, empty chair dialogue, the therapist helps the client to experiment with expressing their needs, like rehearsing the conversation with their boss in a safe, controlled setting. There is something to be said when you rehearse the conversation, but you notice how it feels in your body. You can embody this new way of being in contact with others. Contact is another key word not mentioned here, but Gestalt therapists, all they ever talk about is contact, polarities, and unfinished business. I mean, I think it's great. I'm not saying it in a bad way. Just it's a nice, it's a really profound theory and I guess philosophy of uh, human relationships. The goal is to help the client gain clarity on their own needs, become aware of their patterns of avoidance. And yeah, responsibility is another keyword, like to take responsibility for yourself, for your life, for your happiness, your feelings, your behavior. Take responsibility for their choices in the present moment. The therapist emphasizes self support and encourages the client to step into authentic self expression without being held back by past fears.
Yes.
Yes, my choice is to work with Gestalt therapist or integrative, but as we will see from all the other therapists here, there's something to be gained from each and everyone. So combination is always best.
So much of the theory sounds familiar, like combining with the classical TA, and also some values of the relational TA are here definitely. So
Mm.
it sounds like Gestalt has a lot to offer.
Mm. Well, yes, that's definitely true, and I look forward to hearing comments on what we've said, how far off base we are or not. And I look forward to seeing maybe you, Sanja, in a future video. We're going to talk about feminist therapy, psychedelic assisted therapy, person centered therapy, EMDR, DBT, narrative therapy, mindfulness based therapy, transference based therapy, existential therapy, and so on. Um, Thank you
You're welcome. It
and
was
see you soon.
nice. See you soon.
Bye.
Bye bye.